So right now, one of the things that I love that I can do is to go straight to my office, and then we sit here and we talk about how are you managing stress, how are you sleeping, and about things that I've never spoke in my whole 30 years before. And in the kitchen, let's talk about substitution. Yes, you love tacos. Oh my goodness, we can do them very, very, very healthy and very. Try this recipe. Never in my life was I giving recipes to my patients.
This is the Healthy Lifestyle Solutions podcast, and I'm your host, Maya Acosta. If you're willing to go with me, together we can discover how simple lifestyle choices can help improve our quality of life. Let's get started. Before meeting today's guest, I would like to share another review by a listener. This person says, fantastic podcasts filled with insightful guests and useful practical information for people to live their best, healthiest lives. Our bodies are the only vehicles for moving around this planet. And once it starts to deteriorate, it's very hard to undo years and decades of poor habits. I'm so glad Maya has created this platform to teach people about preventive wellness and living. She also does a great job asking insightful questions of guests. Looking forward to future segments. And this is by J. George 792. Thank you. And like I said before, I have made it so much easier for all of you to rate and review our podcast. If you're interested in sharing how you're enjoying the content, simply go to ratethispodcast.com/. HLS. And also, I've said, come on over to my Instagram account at Maya underscore HLS underscore podcast. This is where I'm sharing short clips of my conversations with my guests. And also, I like making interactive or kind of fun reels. I'm having a good time on there. And so that's where you get to learn a little bit more about me. And if you're interested in joining our newsletter, this is where Dr. Riz and I share information about upcoming events, not necessarily always put together by us, but where I let you know what's happening in the plant based lifestyle medicine world. I like to share recipes. I like to share, highlight some of my guests that come on the show. So the link for our newsletter is bit.ly/ Maya Acosta. And what you'll get in that link in return for your email, because you are signing up for our newsletter, is a guide that Dr. Riz and I put together on preventing cardiovascular disease. It contains some insight to the world that Dr. Riz is involved with in terms of atherosclerosis in his work as a vascular surgeon. So he writes a little bit from his perspective about what he has seen with chronic disease. And then we offer lifestyle medicine solutions and the pillars from lifestyle medicine that you can implement to prevent cardiovascular disease. And we also have 10 recipes in that guide. So I hope that you enjoy that. Again, the link for this guide is bit.ly/ Maya Acosta. All right, let's talk about today's episode. So, Dr. Yolanda Caudill-Rivera is known as Dr. Beet by her patients, her small patients. She's a pediatrician. She organized and created her practice called the Tiny Beet. After 30 years of practicing as a pediatrician, Dr. Beat learned about lifestyle medicine and then changed her entire practice to create one that really fosters the pillars of lifestyle medicine so that she can teach her patients about using exercise as medicine and food as medicine and stress management. And so her practice is called the Tiny Beat. And it's so much fun because we talk in this conversation, we talk about how her family, they all have contributed to developing this practice. So all the links, as always, the full bio and the links for each of my guests can be found on my podcast website, healthylifestylesolutions.org. I hope that you enjoy this episode, and please let me know in the comments what you think about it. Thank you again. Welcome, Dr. Beat.
Thank you. Thank you, Maya. It's a pleasure to be here.
We did have a little bit of a conversation yesterday as we, got to know each other. And by the end of the conversation that evening, I sat down with my husband and I said, "Let me tell you about Dr. Beat." And I was just so excited to learn about everything of how you created your own practice and how you're teaching lifestyle medicine to children because you're getting them very early.
Yes.
Yeah, so let's learn a little bit more about you before we move on to the practice that you now have and how you navigated the pandemic. Tell us a little bit more about you. In your bio, we talked about how you were from a small town in Puerto Rico. Tell us about that and how you decided to go into medicine.
Well, yes, I'm the oldest. I was always very bossy. So I'm the oldest of four or five. So I was always, giving them orders. So I don't know if that had to do with medicine, but I know I loved science. So when I was in college, to go to college, I chose science because I love biology. And then I knew I wanted to do something in science. I had no idea what it was. And I remember when I was a kid, I was watching. There was a show called. Oh my goodness! It was a nurse. It was a black nurse, and Diane Carroll. I think she was the actress, the main actress, and it was a nurse. And I loved that show. It had to do with medicine and stuff like that. And I told my mom, I was like five, and I was sitting in front of the big TV on the floor. I said, "Mom, when I grow up, I'm gonna be like her." And Julia, I think it was. And my mom said, "You know that you could be a doctor too." And I'm like, "No, no, women are not doctors. That's just the man." So I thought my mom was crazy. And then in when I was in college, I wanted to do something that I could do with science and that I could speak. I love to talk. So the one way I thought I could marry those two was through medicine. And I love the decision because I like to be with people, and I love science. I still nerd.
When you were younger, at that time, you had that mentality that women didn't go into medicine. And I remember when I was younger, I really saw very limiting options for women too. I mean, I'm much older now. So
Hmm.
women have really expanded all fields as well. But when you were in medical school, were you one of a handful of women or was it like 50-50?
By the time I was in med school, there were quite a bit of us, but the first female physician that I saw, I met her in medical school in Puerto Rico. That was, I had no role models to go by.
I bet.
So I was, yes, first were the professors and then the physicians, you start the first years. But yes, I realized, my gosh, this is the first physician I know that is a female, even though there were several of us in the career already. But
Mhm.
yes, I had no role models. Like it was a
Yeah.
very interesting thing. I had a very good male pediatrician though. He was very good.
How did you decide that you wanted to work with children as opposed to working with adults?
Well, I'm a nerd, and every time I would go to a rotation, like it was internal medicine or it was pathology, I was like, "Oh, this is what I want to do. Oh my god, this is so interesting. Oh goodness, this is." And then it was not until I got to the rotation of pediatrics that I felt that I was home. I was like, "Oh gosh, this is what I'm gonna do." And when I told my mom, "I know what I'm gonna do," she said, "I knew it. I knew you were gonna do that." I didn't know that. And so it is the children, they're super interesting because a baby is a completely different thing than a 5-year old or a a high schooler. They're like totally different animals. They're different everything. So that is so interesting. And in addition to see the babies from zero to until they can bring your children to you, at I mean, that makes it is such an exciting thing to see the kids grow.
I also feel like it's a certain personality. You did probably help to raise or take care of your 4 younger siblings, right? So maybe that caretaking also, like there's
Maybe.
a
I never thought about
yeah.
that, but I do like the fact that I like to be silly. And being a pediatrician allows me that freedom to be me and wear silly socks and silly shoes and be myself. Actually, it's interesting because one of the things that I noticed going into the residency, not so much through med school, but as a resident, I realized that I was being the professional doctor that I suppose, I mean, I expected to be, like serious and, proper. But then I realized I was not being myself. I was not being true to myself because I am silly like my father. So what I started realizing, I am in the right profession to be myself, to be silly and just crazy with the kids. And I would sit on the floor to examine them, and I would be myself, and then it freed me to enjoy more what I was doing. Absolutely.
When I was an elementary school teacher, I think that childlike part of me came out as well because I taught various levels in elementary. But when I had like a pre-K or kindergarten
Uh huh.
class,
Uh huh.
you sing to them, you dance, you
Yes.
read books, and you have a lot of fun. And then suddenly it's like I remember I would laugh and it was genuine, like
Yes,
what I was feeling
yes,
inside.
yes, yes. Oh, children,
Oh,
yes, bring the best
yeah.
in us. Yes.
Yes. So we're going to talk about what life was like before you learned about lifestyle medicine and what life is like for you now with your private practice. So you've had 30 years of experience under your belt working with children. Can we paint a picture of what that was like for you? What kind of conditions you saw? I know that on my end as a teacher, we would the nurse would tell us to look out for signs that there might be some type 2 diabetes developing in our children. What other things do you see?
Well, one of the things that actually led me to discover lifestyle medicine was childhood obesity. Like I said, 30 years ago, when I was in the residency, I remember this argument about in between the endocrinologist and other physicians that about a child that was I think the endocrinologist said that he had type 2 diabetes, and they were like, it's not possible that he has type 2, this is adult diabetes. And I remember that argument, and he says, no, it's not type 1, it's type 2. And well, that happened, but then all of a sudden we started seeing more and more and more children, and now it's pretty much the norm. It's like, having another chronic condition in children, unfortunately. So we see it very, very common. When I started, it wasn't happening. It's like, so that made me, and then that together with the fact that I was seeing more children with obesity as well, not just the type 2 diabetes, but what led them to the type 2 was the overweight or obesity. And or just like you mentioned, acanthosis, just they still didn't have it, but they have that marks in the neck, and then you're like, they're heading into that direction. So seeing that in children and knowing or feeling that I was not making any difference because they were not getting better made me look for solutions. I said, I have to find something. I'm not doing my job. I am this. I don't know what I'm doing. So I found out this advertisement for Institute of Lifestyle Medicine in Boston had a conference December of 2018. And I was like, it's something, the chef program and something like that. And the first time I saw it, it's like, that's not, it has nothing to do with me. But the second time I saw it, it was something that told me, you have to read it. You have to read it. And then I read it, and I was like, well, maybe there's something here. Let me look into that. And I look at the information, and I decided I was going to do that. And it changed my life. It changed my life because right there in that conference, I saw the data was not different than when we've been used to see. It was just like more about the same. Yeah, you need to eat more vegetables, you need to eat more fruits. That's good for you. That's good for type 2 diabetes. That's good to lose weight, or that, but it was the other things. MI, motivational interviewing, the getting deeper into the root cause of the problems. Not just, a child has constipation, eat more fruits and veggies. Here's his prescription. There's your Miralax, and I'll see you. See, let's see how it does. Um, it was more than that. Let's see, what are you guys eating? How are you guys doing exercise? And how are you guys sleeping? And a whole spectrum of things that I was not definitely doing in my practice. I was just touching the surface. And it gave me, and then in addition, well, if you want to do something for your patients, you try to do it for yourself. So I started, introducing that type of eating in my house. So we're eating more, cooking more with vegetables and fruits. And my husband got on board, and the months passed. I lost 30 pounds. My husband lost his medication for cholesterol, and I was feeling so much more energy, with more energy, and I saw that I was asking more about what was going on in the household with the lifestyle medicine pillars. And so it that out of that conference, I came out like literally more in love with my profession, because I felt I had the tools that I was lacking all these years. It was a good, I mean, it was a conversion. It was like, oh gosh, I need to do this. I want to do this with all the kids and the families.
Well, we often talk about how that helps to reinvigorate a physician. I always believe that all physicians go into this field because they really do care about people. But when you're given the proper tools and also the fact that you can empower the patients, I can see how that would be even more rewarding for you. So then we talked about how in 2019, and I'm surprised because you learned this in 2018, and a year later or so, you were in Florida for the Lifestyle Medicine Conference taking the board exam. So tell us about that.
So yes, out of that, I started reading more, and then I signed up for the chef program. It was like a 6 week where it's coaching. I can't remember, coaching, health, um, which from them too, from the Institute of Lifestyle Medicine, and they teach you how to be a coach, coaching families to involve more of the cooking. Because one of the things, and we see that a lot, is not so much, I mean, families that cook, or people in general, adults that cook their meals, have less problems than health problems than people that have the packaged foods that have so much fat and sodium and heaven knows what other things. So, encouraging the parents. And personally, that's one of the eye openers for me, because one of my excuses is I have no time to cook. You guys crazy. And then in the course, they start teaching you about, like you cook in batches, and you do this, and then you can do this thing and make it. And all of a sudden, I realized that it was much easier than thinking, oh, I have to come and to defrost. Oh, I didn't defrost this meat, or I didn't do this, and it was like, I have beans. Psh, I'm done. This is, I have beans. I have this. I have, and then trying to make it look like a rainbow, and trying to incorporate spices, like more about the Indian flavors and things like that. It was like, became like an experiment, and it was a very interesting experiment for my taste buds, and my family started liking it and get involved. My daughter to the Ruby program, because she loved it so much. So she is Ruby trained even, and so that was it was good that I had no idea that I was going to enjoy cooking.
You went from Boston learning that, but then you said you attended something else in Pittsburgh.
Yes, I went to a conference from the Kelly Foundation, Dr. Megan Grega, and I went with my husband. It was a smaller conference, and that's what made like the shift in my family, because my husband was completely on board. He saw the evidence. And he goes like, "Well, we're gonna do this. This it makes no sense that we don't do this," And that's after that. In the meantime, I was studying, working full time, and studying for my boards because I really wanted to be certified. I wanted to be bringing that information, to have that under my belt, to have more credibility that this is something real. This is something that changes lives. And so I did the board, and I was so happy that I passed. I wasn't sure that I studied enough because it was never enough. I mean, there was so much information and a lot of adult stuff that it was all new for me. So, but I passed, and then after that, I wanted to incorporate even more that to my families. And then I decided I was not going to renew my contract with the employed position that I had because I wanted to do lifestyle medicine for the children, for the families.
Well, and we know that the current model, the way that Western medicine is practiced, it limits your access to patients. So you only have a small window to see them, to interact with them. You don't have the time to teach them how to incorporate more plants into their meals and things like that. So tell us, as you were preparing to make this transition, we were also in the middle of the pandemic. So how was it? How did you make it even happen that you created your center last year, 2021? How did that happen?
Yes. Well, I had no idea what I was doing, to be quite honest. So, small business administration, some friends that know about these things were guiding me because I honestly didn't know. And then I just knew initially I wanted to be employed, but that didn't happen. So, I said I had to do it on my own. And I wanted to do the traditional fee for medicine practice. I had no idea, I didn't know any better, but I discovered, looking for ideas and stuff like that, I found out different practices in that do direct patient care, which is kind of like concierge medicine, but we do not take the insurance money to pay for our services. The patients can have their insurance to pay for their stuff like referrals and anything, medicines and stuff like that. But my services are paid with a membership program. So then I realized that that was the key that I needed. That was the other piece of my puzzle, because by having direct patient care, I see one family at a time. I see a limited number of patients because I don't have thousands and thousands of patients on my panel. I see a limited amount of patients at a time. I see one family at a time. So I can have 60 minutes to 30 minutes, whatever the family needs me to have. And that gave me the freedom that was what I needed to be able to talk about lifestyle medicine. And the other thing, for example, a child with obesity that comes and see me, and he comes in, I normally, in my prior practice, I had to weigh him. I have to, or her, I had to get their weight. And sometimes it's very frustrating because we're, even when you're doing everything right, that's not something that happens fast, and everybody wants things to happen fast. But the truth of the matter is that that's not the main problem, that's not the main issue, and you don't want them to emphasize on that number on the scale. And but I still had to weigh them because, so that the insurance will pay for that visit, we had to get all the vital signs and all. But once they saw that I spent like 10 minutes of my 15-minute visit trying to impress on them that we want to do is change the way we do things, not to look at the number as that is the thing that we're trying to change. But it was very hard because they have already seen it. So right now, one of the things that I love that I can do is to go straight to my office, and then we sit here and we talk about how are you managing stress, how are you sleeping, and about things that I've never spoke in my whole 30 years before. And in the kitchen, let's talk about substitution. Yes, you love tacos. Oh my goodness, we can do them very, very, very healthy and very, try this recipe. Never in my life was I giving recipes to my patients, prescriptions, yes, but not recipes. That was so interesting, a shift that I was not expecting, and I love it because now I cook that in my house, and we know it tastes delicious. And some
Mm-hmm.
patients give me their recipes, but finding substitutions, things like that, is what makes it, oh my goodness, so much different and so rewarding.
Right. I also imagine that since many physicians are not trained in nutrition the way that we know nutrition to be, that for you it's like you're preaching what you already practice, and you have the resources, you have the information to share. Aside from a typical physician just saying, "Well, just eat more vegetables," and then
Yes,
just sending
yes.
off the patient to figure it all out by him or herself.
And
Hmm.
then, oh yes, I'm still learning about nutrition. I mean, this is,
Hmm.
I still have to refer people to dietitians because I can consider myself that I know everything about that. I'm still learning about that.
So tell us more about how you work with children.
Yes, one of the interesting things I've learned through this process is, for example, parents, two things. Parents say, my child would not eat anything green or anything, orange, for even if, if it's to save their life. And the other thing is that one part could be that they're not exposed to that, or they're not exposed, like sometimes I tried, for example, broccoli, and the first time it was not cooked well or something, and I might have that experience as broccoli is bad, period. I'm not going to give it a chance. And then the other option is, or the other possibility, with children that may have sensory problems. And that is a big thing because parents, they would keep insisting, and these poor children, they really have to have another approach. They need to see specialists for that. And one of the approaches that they do is, for example, just smell, let's say, an apple, just smell it, just smell it, learn to smell an apple, and then after that learn how to lick the apple. You go really, really, really slow to be in contact and to be accepting that new food. And is later along the line where you're going to start tasting the apple, and then you can lick, you cut it and you lick it and stuff like that. So it is really important because many, many times these children suffer because they're forced to eat, which is something you would never, never, never want to do to any child. It doesn't matter if it's a newborn, it doesn't matter if it's an adolescent. Forcing children to eat, forcing an adult to eat, is never a solution. So l- even, and that's one of the things, for example, that I've learned, like letting the babies to play with the food, putting them in through their nose and every hole on their face. It's okay. It's okay because they're learning to interact with that food, and they will. It's more likely that they will be accepting that later on.
It's so interesting to me that a lot of times you see that parents are concerned about the child making a mess and dropping food. I so what you're saying is just allow them to explore freely
Yes,
the food,
yes.
enjoy the food the way that it is.
And trust the kid's instinct. I mean, many, many parents, I'm a Hispanic, person, woman, and I grew up with grandmothers that I took, like you said, I grew up with a lot of grandmothers, and God forbid that you didn't finish the plate, and God forbid that, oh my goodness, this kid is so skinny, she's dying, you have to be. I remember I gained a lot of weight in college, and my grandmother was in cloud nine. You're finally, wow. And I was like, Abuela, I can't believe you, I am overweight, I'm not fine, this is not my normal weight. And so, but she was happy because now you're healthy. So, and that's they think they're doing something good, and they're harming these kids. I mean, my mother, for example, she had some a serving of soup before dinner, and she said the moment that they put the plate in front of her, she started crying because she knew that with the soup she already had it. She didn't want any more, and she had to eat more, and she would cry. She said eating was a torture. When she went to college, that she had no one doing that, She became, she doesn't know, she was anorexic. She had anemia, and because she was in charge of what she was not gonna eat, and she was not eating because she had control over that. So it's horrible, to force children or anybody to eat. Parents need to learn to trust the kid's instinct and respect. You feeding a baby from the breast or from a bottle, learn how to do pace feeding, so you're not pushing the bottle, and they're drinking because they don't want to drown, rather than eating at their own pace, and a lot of people don't do that because they think the babies are going to have too much air in the bottle, and I mean in their stomach, and that's not true. And from zero, you not a baby pulls away, respect that the baby had enough, even though you don't think it's enough. And if the baby's or the child starts losing weight, then there are other solutions to do that, and but none of them involve forcing a child to eat.
What is the biggest lifestyle issue that most of your patients and or their parents have? So in other words, is food the biggest issue throughout their life, or is it lack of exercise, or is it having too much stress in their life?
There is a combination of factors. There is a genetic part also. I mean, children, it breaks my heart when, for example, a child, has genetically, they're not never going to be like, I've always been on the skinnier side normally, but some people are not. Some people are always not on the closer, on the higher ed spectrum, and that might be normal for them. So the same way that a child could be skinny and might force themselves to gain too much weight, or more overweight and force themselves to lose weight, sometimes they have to be a balance in that, and they have to understand their genetics too. But there's also, and something that is very dear to my heart, is sleep. Sleep is not taught, you know in med school, very little, and it should be taught in school, like in that's something is stressed in school, that this is very important. As a society, we don't stress sleep. So I mean, we stress work and work and work, and you have to be productive, and sleep is, we know, whenever you have a time. But when you don't have that cycle established, a lot of things are affected in their system. So one of the things I address a lot is the sleep, and physical activity, but not in the sense of exercise. Physical activity in the way of just having fun with it. For example, I don't like running, I don't like jogging. That's not on my DNA to enjoy that. So I tell the parents, the patients, if you ever see me running in the street, call the police or run in my direction, because that's not normal. This is not something I enjoy. I like walking, I like running my bicycle. And I know that's one of the pillars that I need to improve myself, like strengthening and that type of thing. Exercise is not something that I, do naturally, but that's something I understand the benefits of it. And
Mhm.
for people with children, young children, just go outside and play your games when you were a kid. Just become a kid again, and try to enjoy it. It doesn't
Mhm.
matter if it doesn't have to be an organized sport. They don't have to be part of a team, none of that. Just enjoy being a kid again with your children. Teach them your games, and it's good not just for physical activity, but it's good for the relationship as a parent with their kids.
Mhm.
So, and mindfulness and type of managing stress is another thing that I address, because a lot of people have no idea that that is so beneficial, because they
Mhm.
continue on and on. This is life. That's how we do it. Well,
Yeah.
there is a solution. There's a way around that.
There's this idea too that compared to many of us, and I say many, I don't know. In my household, my parents raised us to be very outdoorsy. So when you talk about cycling and being physically active outdoors, I'm more that person than the person that goes to the gym.
Uh huh.
And I find it so beneficial to spend time in nature, but our children are more protected. They're indoors a lot more. So that's another topic that you probably speak to your parents about.
all day long. For the same reason, I try and I stress, if you have 1 hour, at least we want the kids at least 1 hour of physical activity. Ideally, is more. Like you said, like you were as raised as, as a kid. I went outside, and it was until it got dark that I hear my mom calling for us. Joanne! And I was like, oh my gosh, I have to go back home. So it was
Mhm.
just playing with the kids, in the front yard, or the
Yeah.
whatever, whoever house was close by.
Yes.
And that's so important. And you know what? There, as a society, we want to find ways that children can be kids and do those things. And there have been so many fears instilled in parents of, like, they don't, you have to watch them 24/7. And of course, but there is a risk of children when, no, they don't do that. That is not little. It's a big risk. And they, being in nature, exploring, getting dirt and looking for worms and stuff like that, that is very important for the brain development as well. So, and they can get more out of that than that they can get on a computer on a school lesson.
So let's talk about the Tiny Beat. Let's go back to when you put your practice in place and tell us how your children participated in the rebrand and the building of it all.
Yes, well, you mentioned I have 3 kids, and when I was developing all this, learning about business and all that, that I had knew that was another thing that I had to learn, not just the science of lifestyle medicine, not just the pediatrics that I had to learn, and it was business and how to develop these things. Well, I had to develop a website and all this, a logo and all those things. And I'm talking to my kids, and it was so funny because they already knew what the role they had, but I had no idea. I thought it was, something I had to do on my own. And I didn't know I knew my son had studied something in computers, but I had no idea what it meant. So when I would he were talking about development of the website, I was checking on one of those things that is, like ready made, that you just put your information. He goes, no, mom, I'm gonna do that. What do you mean you're gonna do that? No, I do that. That's what I do. Oh, really? You know how to do a website? You can do that, mom? And he was like, oh my gosh, I can do that. I said, okay, if you can. And then my daughter, she's a graphic designer, Michelle, and then she is like, no, mom. And then she started bringing ideas, and her best friend, they came with a Tiny Beat. And because tiny for pediatrics, beat because it's a, play with the words, because in lifestyle medicine everything is a little bit at a time, so it's a play with words. And beet is a fantastic vegetable anyways. And the colors, so he had the colors that we could use. He had the play with the words, and it was a fun way to say it. So and some people say they think that they're going to come and there's going to be a restaurant or a place to eat. But so then she designed the logo and the branding. And then my youngest, she's a linguistic major, and she is the social media. There is nothing, I mean, she has to proofread everything, because I'm a mess writing in English. So she's like, "Oh, mom, no, no, you're not gonna send this. I have to read. I had to redo that." And and my husband did he knows carpentry, so he did the countertops on my office. So I'm the only one that hasn't done anything is my dog, because it's not well trained. But everybody else
Yes.
had to do with this. It was
That's
wonderful.
wonderful.
It was such a good. I had no idea that I had that in my household. It was so funny as it was developing. I was like, gosh, guys, this is wonderful. And it's been a labor of love too, and to have the
Yes.
family and the kids involved.
Yes, and I now notice that you're wearing under that robe the color of beet. So you're actually
Yes,
wearing your color as
this is
well.
the Tiny Beet, the main color. I don't know if you can see the arches there. I don't know if you
I
can
see
see it.
that. Mhm.
The arches
Yep.
of the thing, the main beet that most people know.
So let's talk about the differences between the model that you once practiced in when you were an employee for someone else, as opposed to the center or the practice, the physical place that you now have as your own. How different is it? Do you have, I imagine, like, if we had a practice like that, we would have posters up and food everywhere, like posters of food and fruits. And what can children expect when they visit you?
Well, this looks more like a house. I had a kid. It looks calming. The colors are, like warm, and it's not overwhelming. With there's pictures of fruits and stuff like that. I had an experience the other day that it was fantastic. I have a 3-year old first visit here, and he's a nonverbal child, suspected maybe he's in the spectrum of autism. And that child came, and he right away have a rocking horse, and he went to that, and he was there, and then he saw some other toys. So he wanted to be there, so his parents and I sat on the waiting room, and we started getting the information there, because I see only one family at a time. So I locked the door so he wouldn't try to escape. And all of a sudden he's playing, and he hugs my legs, and he puts his head on on my knees. I was in cloud nine. I was like,
Oh
oh my
my.
goodness. And the parents look at each other like, he doesn't do this. This is fantastic. And I was saying, he probably does not know that he's in a doctor's office. I don't know, he's visiting somebody that has
Yes.
toys and whatnot. And after that, I examined him, and I was ready to examine him on the waiting room, but I had to get my equipment. He followed me, and he got on the top of the exam table. He let me see his ears. He opened his mouth for me. I did the complete health exam without him budging. He was actually enjoying it. And I
Mm.
mean, that was, never in my life, in my 30 years, have I done anything like that. Because when you're in a practice, already when there is a lot of sensory issues, or stimulation when they walk in a regular pediatrician's office. And they're already anxious, and then you have to see them quick. You don't have time for them to warm up. You don't have, the
Mhm.
not because they don't want to. No, the pediatricians want
Mhm.
to enjoy their kids too, their patients too. They do, but it's the way that it's done. And I was spending a lot of time doing coding rather than reading medicine or spending time with my patients. So I
Mhm.
much rather come here in the middle of the night to see a kid than being in the middle of the night putting codes in a computer. It's
Mm,
so
mhm.
rewarding. I know this mom is going to sleep better because I checked the baby, and I'm going to sleep better because I know
Yes.
what's going on, or what needs to be done. Oh yeah, you need to go to the emergency room, or we can wait and see him tomorrow. So it is a completely different paradigm. This is a different set of game. It's a
Yeah.
different game.
I bet also that that child probably felt that warm energy that's inviting of the place that you've created. Do you offer cooking classes?
Not yet, not yet. But that's something that I would love. I have a space that I would not so much like cooking classes, but something like some instructions on how to do. I don't. I mean, I would need a lot of equipment for that. But
Mhm.
I also thought about pairing with a chef in town that we could do something like that. Um, as
Smart.
yes, that yeah.
Yeah.
And then the other thing I wanted to do is group sessions with adolescents, or
Yeah.
also some book clubs. There is a couple of books that I want to do, book clubs. Thrivers from Michelle Borba. Oh
Oh
my
my
goodness.
goodness.
This is a book that
Yeah.
I want to do a book club for, for the parents. Not so much for the kids, but it's for the parents. And
Yes.
there's things like that that I would love to. I have the time. The other thing I have the time to do is developing a with a doctor in physical therapy from Southern University here in Savannah, Armstrong campus. Um, we are developing this. It's called the challenge, the Tiny Beet challenge, where we're working on our pilot program where we go to a school and we teach the kids. It's a challenge that you're gonna sleep however amount of hours per depending on what age group we're talking about,
Hmm.
every day, to try to do that every day, including weekends. You're gonna do 1 hour of physical activity outdoor, ideally outdoors, and you're gonna eat at least one or two more fruits every day, fruits or veggies every day, just one
Hmm.
more, two more. And we try to, and I was encouraged. There is Sean Conaghan is a teacher in Dublin, Ireland. He is fantastic. I heard Dr. Yami's podcast and she interviewed him, and I was, my goodness, I was so impressed. I contacted him, and so he gave me the ideas on what is it, because that I wanted to do something with the schools, and that's what he's doing. And in his school, he started um, teaching. He had the teachings cooking. They do breakfast in the morning, and I think they had dinner in the afternoon or something like that. And then they would do physical activity. And the kids, they were saying how much better they started feeling, and there was so much. I mean, it was amazing. So that, and the other person that inspired me is Dr. Yum, of Dr. Yum organization. So these are, she's a pediatrician, and she started cooking in her office for her patients, and now she has a nonprofit for that. So
Oh,
I know that it's been done. I'm still learning how to play the business, but
right.
it's this on the list of things that I would like to do, to have more in-depth, hands-on, with the patients and the families to, yes, to learn how
Yes.
to cook, especially families that have children with sensory things. Just let them play, and if they find it icky, that's fine. They can just touch it like a little bit, and but
Right.
that's progress.
Okay. And so are you offering any of this information in Spanish?
Yes, I try. It takes a while to translate things, because it's I don't it's not a direct translation. Otherwise, and my kids always tell me, when you translate things, it's so much longer in Spanish, or it's so much longer in English, or it's because well, Spanish is my first language, so I probably will talk more in Spanish. And then culturally, it might be different what you say or what you can add. So it is not a direct translation. So it takes me forever. And even though I try to do more, it's time consuming. And my kids speak Spanish, but not to the point to translate anything.
I get it. I feel like I'm in the same shoes that even though like I was a bilingual teacher, meaning most of my students, the majority, their parents only spoke Spanish at home. But I was teaching in both languages. And now with all this information, it's like, wow, having to, if you want to, reach the Spanish speaking community, you have to get those resources in Spanish. So, a couple of more questions, just kind of basic questions for parents, especially new parents. At what point in a woman's pregnancy, at what point should she start looking for a pediatrician? What are your recommendations on that?
I think as soon as she finds out that she's pregnant, she might want to start doing her research, to see what's in the area, and stuff like that. And as soon as she finds out, and hopefully before, one thing I tell them: start eating as many fruits and veggies as you can possibly add to your diet, because your baby is literally eating what you are. And not only just the food that you're eating, but it's the microbiome on the baby. The taste buds are developing too with that taste of whatever she's eating. So not only you want to start looking for a pediatrician, you want to start looking into, up in your game, and if you have not already, but eating a lot of vegetables and fruits and seeds and nuts and anything plants.
But I was looking at your website to see if there are any other questions that we may have, like that you might have common questions or concerns just in general from parents, like questions about vaccination, questions about, I don't know, other things related to just a child's maturity, like are they developing at a reasonable pace? Are those some of the concerns that you also address?
Yes, I mean, we do developmental evaluations in all the well checks, like they're recommended for by the Academy of Pediatrics. In addition, because I have the flexibility of, if there is a concern, I can probably see them before. Let's see, where they were in the speech or whatnot. I can probably don't have to wait for a checkup, and because the parents don't have to pay another copay, it's
That's right.
it's more or you can text or something too. And yes, I do. It's evidence based, so I do believe in the vaccines. I have them
Hmm.
here, and for the first time in my life, I've been the bad guy. I am the one that puts the vaccines, so I feel so bad that I have to
Oh,
do that because I don't have a nurse, so it's me doing it, and I had to learn to
oh,
suck it up. Okay, you're gonna be doing this, and you're gonna make this child cry, which is that was a big stretch for me, but you know, it's it
yeah.
is what it is.
It's
I had a little girl the other day that I put 3 shots, and then she had to come in a month because I didn't have the fourth one that she needed. So she came a month later, and she told the mom the day that she left that she was never gonna see me again, that she didn't want to come here ever
oh,
again. So she came a few days ago. She came happy, and she hugged me right away. As soon as she walked in, she hugged me. I said, well, okay, so I guess we're friends again.
oh,
So, but it took a little bit of convincing that it's going to be only one. And so, anyways, that's the hard part.
yeah,
But,
yeah, I bet.
yes, I believe in vaccines.
So I wanted to mention again the direct patient care. I want to come back to that because on your website you have here some of the benefits that the average patient wouldn't have with the the basic Western model. So one of them is that you do at home visits for newborns. You also offer telemedicine, so text, phone, telemedicine. You teach them how to cook, and then you talk about lifestyle medicine just in general. And we know that insurance companies, and when you have that kind of model, you're very limited. It's like the insurance companies just took the doctor away from the patient in many ways. You're established as sort of like a membership program, a membership.
And one of the things that I love, I feel is kind of like the old fashioned way of practicing medicine, where your physician was part of the family and knew everything, and it was very involved with the family. So
Yes.
by doing this, I feel like it's going back rather than moving forward. It's not a new thing, it's an old thing. The
Yes.
physician is part of the family. My pediatrician, I was a sick child. My poor mom, my poor parents. My mom was 20 when she had me, and I was a good teacher for her. And she was in that man's house. There was no cell phone. So he would give her, okay, this is where I live. I'm gonna be playing golf today. So, if you need me, I'm gonna be here, and I'm gonna be so he was part of our family, and this is kind of like the modern way of doing that, of practicing an old-fashioned medicine, and I love it. I love to be part of that family.
Awesome. Are you taking new patients?
I'm gonna fill the panel. Once I fill the panel, I will stop taking patients, but I still not full. So yes, you can call and find out. And I'm also
Awesome.
seeing patients through Planted Forward. I can also telemedicine through
That
Planted Forward. So in
that's right.
Florida, I can see patients mostly for lifestyle medicine rather than pediatrics, more like lifestyle medicine recommendations. like children with
Yes.
anxiety or depression might benefit from. Sometimes, you dig a little bit deeper, and there are many things that can be done with or without medications. I'm not saying that they need to stop medication or they don't need to start it, but it could be at the same time. They're going to benefit so much more than,
Hmm.
yeah, there are a lot of things that we can try.
I'm so happy that you're part of the Planet Forward team. I interviewed almost everyone from the team. I love that you're all female.
Yes, I know. I don't know if it was by design, but we are.
So you're seeing patients through Planet Forward. You have your physical practice. Do you offer anything else for other individuals that are not in either of those locations? Or how can people learn more about you if they just want to reach out?
I mean, you can see, look at me. We try to post informational stuff, educational stuff through my Facebook or Instagram. And those are the only two social media that I'm gonna do, because there's so much we can do. I don't have anything else. And I'm, we're developing a newsletter and a blog to talk about, because the way I like to talk too much. I like to, when I start writing, I write a lot, and my kids said, "Mom, that is too long for a post." But there is a lot of information I want to get out. So they said, "You need a blog." So they're designing that for me, because I guess I like to talk as much as I like to write.
That's wonderful, though. That means you have a lot to say, and people are going to want to hear that.
But it's, once you love what you're doing, it comes so easy, and there's so much
Hmm.
from, like, for example, with sleep. Once you start reading about how much sleep, and the good thing about lifestyle medicine is everything is so intertwined. Okay, so if you improve your sleep, your stress is going to be better. If you start
Hmm.
improving your food, the way you eat, your microbiome is going to get better, your stress is going to get
Hmm.
better, your sleep might get better. So you improve one of the pillars, and the other ones, you're benefiting another one indirectly, directly or
Yep.
indirectly. If you do physical activity, you're going to sleep better, you might lose weight. Or if you don't need to lose weight, you're going to be stronger, your heart is going to be stronger. So no matter what, you start with any of the pillars that you want, and you're going to be benefiting some other pillars right off the bat. So that's why
That's right.
you just want to start tiny bit at a time, tiny bit, just one step at a time. Just if you do that, you're gonna start. You just have to be consistent and not give up, not giving up. It's okay, that didn't
Yes.
work, I'm gonna try something else. But it works, it works, it
Absolutely.
worked for me, it works for so many other patients. It's beautiful. The and social media and the Dr. Beat.
The Dr. Beat. Okay, I'll include the links so we can get it right in the show notes. Uh, so, Dr. Beat, do you have any final message, anything else that you'd like to say to our listeners?
Well, I hope some of you get inspired on trying just a little bit of learning about yourself, and learning what is it that makes you happy, whether it's play outside that you have never done it. Try to start sleeping a little bit better. It'll just, even if you go to bed 15 minutes earlier, just a little bit, your body's going to start doing, it's going to be very, very grateful for you, and it's going to show you in increased concentration, feeling, lifting the fog, or just feeling better, more calm, and learning. I
Mhm.
am a proponent of learning and reading, and look for information, look for sources. I know there's a lot of misinformation in that you can find on websites, on internet. But for example, Planted Forward, they have a lot of evidence-based stuff. Lifestyle medicine has,
Mhm.
the institute, the lifestyle medicine have a lot of information too.
This has been wonderful. I
Likewise.
think you added so much value to my listeners. I can't wait to share this. I did say that I'm going to have probably by the time this episode airs, I will have released the other episode with
The
the
obstetrician.
top. Yes, the topic of preconceptual health and optimizing our bodies, for women who are interested in having children. And then we follow through with talking about how to support children through lifestyle medicine. So, Dr. Beat, it has been wonderful getting to know you and learning about the work that you're
Likewise, my
doing.
pleasure.
Thank
Hope one day we'll meet in person, maybe
I
at the
hope
conference.
so. Yes, I hope so. I plan on going. I haven't purchased my tickets yet, but I plan on going to the conference. So, yes, hopefully I'll see you there. Thank
Bye
you so much
bye.
for
Thank
joining
you.
us.
Thank you. It was a pleasure.
You've been listening to the Healthy Lifestyle Solutions podcast with your host, Maya Acosta. If you've enjoyed this podcast, do us a favor and share with one friend who can benefit from this episode. Feel free to leave us an honest review at ratethispodcast.com/HLS. This helps us to spread our message. And thank you again for being a listener.